Holy smokes, I finally have a ready bed. Let me call the unit. ICU, where the real heroes work. What do you want, ER? You want to give a report? Okay, just a second. Let me put you on hold. Hey, John, is your movie almost over? ER's on the phone, wants to give you a report. Okay, I'll send him to you. Hey, John. Yeah, it's Jeremy down in the ED. Yeah, post-Ross patient came in, got him back. Pressures are still crap, so we got pressors running. EMS's line blew, so yeah. I threw actually a 22 gauge in the thumb. You gotta check it out when they get up there. It's pretty sweet. But anyways, temp sensing Foley, OG tubes in, intubated obviously, and doc working on a central line for you right now. You are not running pressors through a finger IV right now, are you? And what about sedation? You didn't mention anything about sedating the patient. No, of course not. No, we wouldn't do something like that. We have it going in the central line right now. Yeah, and for sedation, yeah, the pressors are working, so the pressure's starting to come back up, so we have that propofol hanging. All right, sounds good. I can look in the chart for the rest of it. And when you guys come up, can you make sure you have the patient cleaned up? Last time you guys sent him up, he had shit the bed, was still in his street clothes, and had all the EMS sheets under him still. Oh, yeah, sorry, princess. I'll make sure to get that done. Sorry that happened. All right, we'll see you soon. Yeah, we're not doing that. Let's just go. We'll take him up. Acronyms from the ER. So you checked into your local ER, and the triage nurse goes out to find you, and you decide to leave the waiting room without telling anybody. So they do a room call times 1, room call times 2, room call times 3. 3 strikes, you're out. We take you off the board. If you come back, you have to recheck in. Left without being seen. This can be before triage or after triage. So if you decided to come to the ER and they took too long to get you triaged, or you decided you had somewhere else better to be, you'd be left without being seen before triage. And then if you decided to go get checked in and then go sit in the waiting room and then you go through that room call times 3 that we just went through, that'd be a left without being seen after triage. AMA, against medical advice. So this is when you're in the ER already and you're either getting admitted or you're being treated for something and you decide that you just don't want to be there anymore, you're unsatisfied with the care and you're going to leave. But you have to sign a form saying I'm leaving AMA, which is against medical advice, because we're advising you to stay because there could be something emergently wrong or critical and you're still choosing to leave. Elope. This one's not really an acronym, but it just fits along with everything I'm talking about in this. So an elopement is similar to an AMA where you're still leaving the hospital, but you're just not telling anybody about it. So you could be in a room and then say the nurse goes in to check on you and there's just no one there. They just decided to leave. They didn't tell anybody. They didn't sign no forms. They could have IV access, port access still, all the things. So they would be taken off as an elopement. Whoa, that car's coming in fast. Hey, I'm probably going to need a gurney up here. Hey, I need some help out here. My girlfriend's overdosing on fentanyl in the car. Please come help. Yeah, I need that gurney up here and some Narcan right now. Ma'am? Yeah, I got a pulse and she's breathing. Ma'am, wake up. Oh, jeez. Okay, yeah, she's awake. Let's get her onto this gurney and get her into the ER. We'll get her checked in. All right, hey, buddy, my name's Jeremy. I just got a few questions for you here. Like, what happened? Like, she's soaking wet and you said she was overdosing, but she's now awake. I'm a little confused. Yeah, man, we were just drinking at home, and then we started using a little bit of fentanyl, and the next thing I know, she's on the ground, unresponsive, and she started to turn a little bit blue. So we threw her into a shower and turned the cold water on, and that didn't really wake her up, so we gave her some shot of clear. Sorry, man, I'm not familiar with the term clear. I'm thinking Everclear, and I'm assuming that's not what you're talking about. I'm not the police, so whatever you tell me is safe with me. I'm not going to call the cops or nothing like that, okay? I just need to know what you gave her so I can treat her appropriately. Yeah, man, like, clear, we gave her a shot of meth into her neck to wake her up. Okay. Yeah, thank you for telling me that. I appreciate it. It worked, I guess. I would never, ever recommend doing that, but you got her here safely. We're going to observe her for a while. She's going to have to metabolize through all this stuff. So you guys are going to be here for a minute. Hi, buddy. My name's Jeremy. I'll be getting checked in here in the emergency room tonight. So what brings you in? Oh, man. Yeah, just out of nowhere, I just started having this lower right-sided abdominal pain. Everything hurts when I move anything. It's crazy, and I can't get the pain to go away, and it feels like it's just getting worse. Okay, so lower right quadrant abdominal pain started about 3 hours ago. Okay. Any allergies to medications that you're aware of, or any past medical history? Yeah, no real allergies to medications. I think I'm just allergic to like strawberries or something like that. And no, I don't have any medical history, nothing like that. Wow, okay. No allergies, no past medical history. You're making my job easy. Hey, in the ER doc, I'll be taking care of you tonight. So, Nurse Jeremy gave me a little bit of a rundown, but I want to hear your side of the story. What's been going on? What brings you in tonight? Hey, doctor. Yeah, my abdomen's just been killing me for a couple days now. I think it's my IBS acting up. All right, well, let me push on your abdomen here a little bit. All right, well, we're going to get an IV started on you, draw some blood work. We'll get some pain meds going for you, all right? Are you allergic to anything? Oh, I'd really appreciate something for the pain. I can't have morphine. I'm allergic to that. And I'm also allergic to penicillins and tramadol and aspirin. Hey, Jeremy, did you talk to the same patient that I did? I don't know. Apparently not. Hey, man, I'm Joe. I'm helping hands down from the ICU and just making my rounds, see if you guys need help with anything. Is there something I can do for you? Joe, nice to meet you, man. I'm Jeremy. Yeah, actually, it would be a huge help if you could go throw an IV in room 9, get a basic rainbow for me. I'd really appreciate it. Oh, yeah, man, I can go throw a line for you. Just basic rainbow, blue, green, gold, lavender. Easy. Okay. Damn, Joe, that was quick. That's got to be the fastest IV I've ever seen. No, I haven't done that line yet. I went in there to do the IV, and the patient in room 9 is awake and talking to me, so I got nervous and I came back out and asked why he's not sedated. Good one, Joe. They're here for a rule-out appy. We're not going to intubate them for that. And plus, you have to have an IV in them to sedate them anyways. You know, everybody doesn't come in here intubated. You have to, interact with patients down here. Oh, you guys actually have to talk to the patients and get them things down here? I don't like this. I want to go home. I want to go back to my unit. Hey, Jeremy. Yeah, it's Steve on the ambulance here. We're bringing in a patient who says they overdosed on propofol and blood pressure's 89/50, semi-conscious. GCS is maybe 14 right now. We're coming lights and sirens. We'll be to you in about 5 minutes. Propofol? Are you sure? I mean, I don't even know how someone would get a hold of that. Oh, okay. If you think it's propofol, you just need to maintain their airway, make sure they just keep breathing. You might have to start bagging them and watch their blood pressures because it's going to tank their pressures. You guys are EMT basics. All right, we'll just haul ass here, and then we'll have a room set up and be ready for intubation when you get here. Hey, Jeremy. Yeah, it's Steve. I called you on the phone. No real changes en route. She's still about GCS 14. Blood pressures are still pretty soft. Yeah, she said propofol. She's prescribed the medication. She says she takes it orally. She takes it orally and has prescribed it? Does she have blood pressure problems? She does? Okay. Ma'am, do you take propranolol? Yeah, she takes propranolol, not propofol. Oh, yeah, that would make more sense. Yeah, I totally agree. I could see where it could be confusing, though, especially if she's semi-conscious and kind of mumbling it. I could see it sounding like propofol, but yeah, we're propranolol. It's a blood pressure medication. Hey, man, it's Jeremy down in the ED. Yeah, I just need to call report and get this patient up to room 902 real quick. Oh, hey, ER. Yeah, that room's still dirty. We're super busy up here. It's going to be a minute. All right, yeah, I'll give you a call back. Oh, that room's still dirty? Oh, man. It's been empty for 3 hours. I thought they'd cleaned it by now. But, all right. Yeah, just give me a call back. All right. Talk to you later. Bye. Hey, Charge, can you watch my people for 2 minutes? Yeah, they're all stable. I'm just going to run upstairs real quick to this bed. I think this nurse is lying to me. I'm calling bullshit. I'm going to go check it myself. Yeah, that's what I thought. That lying son of a... Hey, man. Yeah, it's Jeremy down in the ED again. So I walked up there. That room's just... nice and clean. Looks good to me. So I already set up transport. Patients looks like they're rolling into the elevator right now. So they'll be due in about 30 seconds. Report? Oh, you should have taken it when I tried last time. You can read through the chart. All right. Bye. All right. Whatever, man. All right. Yeah. What a dick.